Welcome to AARP Illinois' virtual event. It's so wonderful to have you with us. AARP is on a mission to connect with individuals across various communities, especially those aged 50 and above. We're here to listen, understand, and address the unique needs of you and your community as we age. Our goal is to enrich your experience by expanding our local activities, providing opportunities for you to discover and engage with all that life has to offer right here in your own community and virtually. As we journey through today's event, we invite you to consider joining our dedicated team of AARP volunteers. It's a chance to make a meaningful impact and help us better serve those 50 plus across the nation. Connect with us and be a part of this vibrant movement toward positive change. Welcome. And let's make this event both fun and transformative.
Good morning, everyone, and welcome to our special virtual event, Alzheimer's Roadmap, Planning for Progressive Needs with Melissa Tucker, LPC. I'm your moderator, Sonia Gibbons-Reed, State and Community Engagement Analyst for AARP Illinois. We are thrilled to have you join us for an event dedicated to providing support and insights for those navigating the complexities of caregiving for loved ones with dementia. We are honored to have Melissa Tucker, a licensed professional counselor with a wealth of experience in grief counseling and dementia support, with us today. Melissa is a certified grief counselor through the American Academy of Grief Counseling. She is also an experienced facilitator and trainer for caregivers and early stage dementia support groups. Before we dive into our conversation with Melissa, I want to discuss AARP and our mission. AARP is committed to enhancing the quality of life for all as we age. We are at the forefront of leading positive social change and delivering value to our members through advocacy, service, and information. Our goal is to make things better for society and play a constructive role in communities nationwide. In gatherings like this, we embody our mission, bringing together knowledge, compassion, and resources to support each other. Now let's delve into our topic for today. Melissa, it's terrific to have you with us.
Well, thank you so much for having me.
We encourage all viewers to ask their questions or post comments on Facebook or YouTube. And let's get into our questions now. What typical cognitive changes and symptoms are noticed in the early stages of Alzheimer's disease?
Yeah, that's a great question, and it's something people really want to know about. So the hallmark of any form of dementia is memory loss that impacts daily living. So it's not just you walk into the room and you can't remember why you were there, but then you remember later on. It's more things like an inability to do familiar tasks. Maybe getting confused in a location that was familiar to you, noticing problems with problem solving, more complicated functions. Sometimes the first thing people notice is difficulty managing finances. Another early symptom can be trouble with language. We all do that thing where it's on the tip of my tongue. When you start noticing early memory loss, people might have really more pronounced word retrieval problems, and that can be an early sign as well.
Okay, that's great. Can you describe how Alzheimer's progression can impact a person's mood, behavior, and memory?
So any form of dementia, including Alzheimer's disease, it's not just a disease that impacts our memory. We think of that short-term memory loss, those repeated questions that people ask. But because our brain controls all different kinds of things, lots of things can be affected by that. Sometimes people with dementia will become more emotional than they used to be. They might be more tearful. They might be more prone to becoming irritated. Caregivers will often say to me, this person has lost their filter. So they might use language that they wouldn't have used in the past. When people talk about dementia behaviors, they're often they have this idea in their mind that their loved one is going to become aggressive. The person with the diagnosis may be afraid that they're going to become aggressive. That's actually not a common or inevitable symptom of Alzheimer's disease. If people are having what they think of as behaviors, what may be going on there is that the person has an underlying medical condition like a urinary tract infection that can make that person be very agitated or confused. People after any kind of procedure where there was anesthesia can have really pronounced confusion for a little while after this. So that's a physiological thing, right? The other thing when people talk about people's mood or behavior is that the person's confused. They're not sure they understand what's going on. That short-term memory loss in the middle stages is pretty pronounced. So they're asking those repeated questions, right? And I think it can help to think of that as a symptom rather than a behavior, right? They're not doing it, to aggravate you. Just recognizing this is a symptom of the memory loss. So you're seeing those repeated questions. You're seeing that people can't do the things that they used to do, and they may become frustrated with that. So those are all things that can impact how that person presents in the world.
Well, and I think the confusion is that we all experience some of these things at different times. And so we don't know if it's just getting older or if it's symptoms of Alzheimer's. So I think that's what people struggle with.
Sure. And there's a big difference between normal cognitive slowing and a dementia process. We all start to slow down cognitively, but it happens really early. Like maybe when we're 35, there's things that we can't do as quickly mentally as we used to. But again, the dementia is something that's really significantly impacting daily living. It's not normal forgetfulness. It's not, oh, I'm a little more depressed or anxious than I used to be, although, you'd want to take a look at that too. It's those more significant impacts that you see in people.
Right. So how do these changes influence everybody's daily living and the need for increasing assistance?
Right. Yeah. So in the early stages, you might not notice that much. The person might not need that many changes. In the early stages, what I recommend if someone's got an early diagnosis, you might have a conversation with them and not even be able to tell that there's something, going on there, but something has come up. They've got that diagnosis. It's important to have a diagnostic driving assessment after diagnosis. You can talk to your neurologist about that, get a baseline of where that person is. A diagnosis does not mean that person has to stop driving immediately, but you want to understand what's going on there. You should help that person with passwords and financial management. If the person with the diagnosis is the person who manages all your finances, you want to get a handle on that. You want to start thinking about, decision-making for care in the future. These are all conversations that it's good to have in the early stages. In the middle stages, the person is more confused. It might not be safe for them to be home by themselves. They might be leaving the stove on or leaving the water running. Wandering is a big concern in the middle stages. 6 out of 10 people with dementia will eventually wander and get lost. That's very frightening and distressing. So at this point, what you're really looking for is that person needs more companionship. So you can get companionship care and home care. You might be looking at senior programming through your local area agency on aging. Adult daycare services can be very helpful at this stage. And not only is this providing some structure and supervision for that person, but it's also helping them stay physically active and socially engaged. And those are really important things to think about in terms of care. When we think about care planning, we often think of those material things like I'm going to get an in-home care provider, I'm going to take them to adult daycare. But care and support of a person with memory loss also includes, their mental well-being and emotional well-being, getting exercise, getting socialization. So those programs are good for that. As that person moves into the later stages of dementia, that last third of the disease progression, that person is going to need physical care, again, because the brain controls everything in our body. That controls our gait, our balance, our eye-hand coordination. So continence, people will generally be incontinent by the time they reach those late stages. So they're going to need to be dressed. They're going to need to be bathed. They might need to be spoon-fed. And at this point in time, it can be difficult to prepare to care for that person in the home. home, even if you have a lot of family support. So this is the time when people start looking into residential care. People really struggle with this. I'd like to normalize this for people. The reality is if people live long enough, something like 95% of people will need residential care. So, this isn't a rare or unusual thing to happen. And then in the very late stages, hospice can be very helpful in caring for the person with dementia. You don't always think about this in the early stages, but it is a progressive terminal illness, and hospice is available for people with dementia in the late stages.
Okay. What are the most pressing concerns you might have regarding care planning for someone with Alzheimer's?
I think the most pressing concern for people is finances. It's expensive. Caring for someone is expensive. If that person is someone with a younger diagnosis, they may need to drop out of the workforce. Many times caregivers will drop out of the workforce, so they're losing their income. So I really do think that's the most significant concern. So get a handle on that. Talk to a financial planner, an elder law attorney. Be aware that there are community supports available for people who can't afford in-home care or adult daycare. If they meet the financial eligibility, you can get those services through your local area agency on aging. That I'm in Illinois, so I'm not going to give like an Illinois phone number, but I'm aware other people will be tuning in for this. But the local area agency on aging will have something like a senior helpline. You can Google that, get connected. That can provide you with in-home care, with adult daycare. Home safety checks can be helpful. Supports of that nature. So I do think it's the finances. It's complicated. People sometimes think that long-term care will be covered by Medicare, and actually that's not correct. Long-term care in a skilled nursing facility is either covered out of pocket, which is very expensive, or through Medicaid. People draw down their assets and go into Medicaid. So if that's going to be what you're looking at, which a lot of people are, I really do recommend speaking to an elder law attorney about, do you need to set up a trust for your children? Do you need to look at spousal asset protection as you're going into that decision? I'm not a financial expert, so I can't advise people on that, which is why I recommend an elder law attorney. So that financial piece brings a lot of anxiety to people as they're looking at this.
Right. And I think it's important to find the right resources and utilize those resources to try and help get through it. What are some of the safety considerations that should be taken into account as the Alzheimer's progresses?
Right. So I've already talked about driving, and I know that's a huge milestone for people when they lose the ability to drive. I would say, if you're working with someone in the early stages, that's probably the first thing to think about. And then as that person moves on, you want to look at things, and people ask me, like, when is it time that they can't be home alone? And that's not really based on a particular time period in the disease progression, right? Is the person at risk for falling? They may have other things going on besides the dementia, which makes them a fall risk. Are they leaving the stove on? Are they leaving water running? Do they just become very anxious being alone? The person with dementia isn't thinking about the passage of time. They may say it's okay, and they never leave the stove on, they never wander, but it's just very anxiety producing for them to be alone. And that's an indication that being alone isn't a good idea for them. If you're getting those, 20 phone calls during the day, that's a sign that they need, more companionship in the home. Is the person prone to wander? Will they get anxious? Sometimes people with dementia believe that they need to go back to work, right? They're kind of at a different place in their lives, or they wake up at night and they think it's the daytime, and they get dressed and they're confused and they leave the home. They might think that it's a weekday when it's not, or they want to go to church, but it's not the day that they go to church. So if you're noticing that behavior, if you're noticing that person with dementia saying things like, I want to go home, but they're in their home, right? They're in their home that they've been there for, 30 years. That's an indication that wandering might be a concern. So the first response to that is making sure the person's not left alone. And then there are ID bracelets, in case that person does wander. And I do always recommend that for people.
Right. That's good information. Please discuss the importance of having a solid support network, including family, friends, and community resources.
Yeah, you cannot do this alone. Nobody who is a caregiver can get through this alone. Because the disease progression is so gradual. People start out saying everything's okay, everything's okay. Their kids say, hey, can I come spend time with dad? No, everything's okay. What plays into that oftentimes is unfortunately still a certain amount of stigma about the disease progression. I don't want to tell people about mom's diagnosis. She'll be embarrassed. I don't want to talk about my husband's diagnosis out of respect for him, right? But then you start to become isolated. The person can do less because of their memory loss, and then you stay with them, and that means you're doing less too, right? So when you first start talking about that diagnosis and people offer to help, say yes. Just get in the habit of saying yes, and then you won't have to ask or later on. So friends, family, neighbors, faith communities, local senior programming that may not be dementia specific, but is keeping people active and engaged. That's all really, really important. And then you're looking at those community supports. And the reason this is so important is that caregivers undergo a tremendous amount of stress. And being a dementia caregiver is one of the most stressful things that a person can go through. And we have a lot of studies on this, and that long-term chronic stress takes a real physical toll on the caregiver. So, that self-care is not a selfish thing to do, right? You're taking care of yourself so that you can take care of the person that you love, that you're caring for. So having as robust a network of support, not just for the person with the memory loss, but for yourself, is just crucial if you're going to get through this.
Absolutely. I agree with that 100%. And people tend to neglect themselves during this. So that's very important. And it's okay to ask for help or to get help. It's okay.
Yeah, it's okay. That's right.
What are the key elements to consider when planning for long-term care needs?
So that financial piece is huge, right? So where are you financially? What's in all the accounts? Think about also, have that conversation if possible early on. What kind of care does the person want? What kinds of care is available in your community? Some people make a decision to move back to where their children are so that they can have that support from an extended community. So what's in your social network? What's available to you? Having difficult conversations about end-of-life care is important. This is something when I'm working with couples where one of them is in the early stages, have that conversation. Fill out your advance directives, right? That's going to impact care down the line. What do we always hear from caregivers when they're in the middle or late stages? Like, I promised I would never put this person in a home, right? And that's often a promise that people cannot keep. And then they feel a lot of guilt about that. If you have that conversation early on, oftentimes the person with memory loss will say, I don't want to be a burden, right? So they're saying, when it's time, I want you to get help. I want you to not sacrifice yourself in caring for me. So that conversation with the person with memory loss, it gives them a chance to have agency over what's going to happen later on when they're not able to make those decisions. So the earlier that you can have those conversations and consult with maybe a financial planning expert, really the better.
Right. And include the patient
in
those decisions. Right. Yeah.
Mm-hmm.
Okay.
We talked early enough. Yeah.
We talked a little bit about how important the resources are, but are there specific resources for Alzheimer's care or dementia?
There are. So we talked a little bit about adult daycare. That tends to be a dementia-specific resource. In-home care. There are support groups for people with Alzheimer's disease and their caregivers. There's the Alzheimer's Association has a 24-hour helpline, and you can call and get connected with support groups or referrals, things that can be helpful to you in your journey. Those are all things that can be helpful to you, dementia-specific. And then of course, I mean, I kind of brushed past this, but early on when you're first noticing those symptoms, you want to talk to your doctor about it. And that seems kind of like self-evident, but a lot of people won't do that. So maybe the first resource you want to think about is that medical team. You're getting referred to a neurologist, getting a workup, getting, hopefully there's a social worker there who's an expert who can connect you with local resources and provide you with some disease education. So probably the first resource people want to think about is getting that diagnosis and getting the medical care.
Right. Okay. So we talked a little bit again about the end of care preferences, end of life care preferences. So how do you start that conversation?
Yeah, that can be really hard. And maybe that's a conversation that you want to have with somebody who's a counselor or social worker, to help facilitate that dialogue, to help have that. If the person is in the middle stages, you really realistically may not want to have that conversation with them, right? Once people get into the middle stages, they generally lose awareness of the fact that they have the diagnosis. So you're not going to keep reminding them of that, right?
Right.
So when I'm having conversations with families as they're caring for someone at the end of life, I think it's really important to name that, to normalize that, to say to the person, you're not letting them die. Sometimes hospice is a difficult conversation, and not every physician is proactive about referring a person with dementia to hospice. So sometimes the family has to ask for that. A way to have this conversation is contacting a hospice agency and getting an evaluation, because the social workers and nurses who work in hospice are really expert at having these kinds of conversations, right? Telling you what your options are. But I think it's important to be open and say, this person is passing away from this illness. This person is dying from this illness. You're not letting them die. There's nothing that you've done or haven't done. But here are some things that can be supports for you as you go through this. When you're having these conversations earlier, or just thinking about this earlier, think about what kinds of care this person wants at the end of the life. If they're able to have this, there are things that can be done to prolong life that might not be really appropriate or beneficial for a person with dementia. A feeding tube, when that person has lost the ability to absorb nutrients, is not going to prolong life and might cause distress, right? So there's some hard conversations that can be had. You might want to initiate this conversation with a doctor, with a social worker, or counselor who has some background in this.
Right. What are some of the most challenging behaviors or symptoms to manage in someone with Alzheimer's?
Yeah. I think the wandering can be very, very challenging. If that person is physically healthy and they're determined to get out of the house, and maybe you're an elderly person caring for your spouse, that is really hard. The person can slip out the door when you're in the bathroom, when you're asleep at night. Very frustrating and frightening for families. So, that's when people need more supervision. You can get a GPS, but that's not going to keep the person from getting into a dangerous situation, right? It's more of a backup. So I think wandering is very frustrating for people. The repeated questions really wear down caregivers. I hear people say, I was so impatient with him and I feel so guilty about that. And it's normal to get impatient if the person has asked the question 10 times. I generally try to normalize that for people. This is a symptom of the illness. It may be an expression of anxiety. They're going to you for reassurance, and the way that they know how to do that is by asking the question over and over again. You can also try to manage that by, what I call an information diet. If you know this person's going to be awake all night, the night before a doctor's appointment, asking the same question over and over, is it time to go? Is it time to go? Maybe don't tell them it's time to go until it's time to go, right? But sometimes that period of time where the person is following you from room to room and asking questions over and over, it can just be exhausting for the caregiver, who may have all the love in the heart, right, for this person, but it just wears you down. So that's why it's important to get some other people in there, some in-home care, so that you can get a break and just recharge your battery to be able to cope with that.
Right. So do you have any tips for caregivers on how they can effectively communicate with the healthcare providers to ensure the best care?
Yeah, that's a really good question. When you're speaking with the healthcare team, you might be really aware that if you talk about this person's memory loss in front of them, it will be agitating to them. So I really recommend that you make it a normal part of the process that you have time to speak with the healthcare provider one-on-one without the person there. And if this person is used to working with people with dementia, they should completely understand that. You can email your concerns ahead of time. You can have a private phone call with the healthcare provider. You can say, hey, when we're here, I really want to talk to you one-on-one about the things I'm observing. And they'll take the person off to get their blood pressure, and you can have that conversation. People feel like that's maybe a betrayal or it's a HIPAA violation, but you can tell the doctor whatever you want to tell them. The doctor may not be able to talk to you, depending on where you're at with the power of attorney, but you can share your concerns. And I do recommend that. And be really frank. It's not a betrayal. It's if the person is very depressed, if they're very angry, if they're very agitated, treat that like it's a medical symptom, right? Take that to the doctor and share that with them. So many times I'm surprised that caregivers are not sharing that information with the treatment team. But we unfortunately don't have good universally available treatments for dementia, but we do have ways that we can treat depression, anxiety, agitation, paranoia, aggression, right? So if you're living with this stuff, share that with the healthcare team.
That is great information. So are there any additional topics or concerns that are crucial to discuss when planning for progressive care needs?
I think we've covered a lot of it. The main takeaway I always want to leave people with is you can't do this alone. And like you said, it's okay to ask for help. Put that oxygen mask on yourself first. And you're doing a great job. So many caregivers say, I'm not doing enough. I don't know what I'm doing. But all the caregivers I speak to, you are doing a great job. You are doing enough. It's not anything you're doing or not doing that's causing the disease progression, right? So take care of yourself, recognize what a hero you are in being a caregiver, and get that help to support you.
Right. Well, sorry for that. We've come to the end, unfortunately. I want to thank you so much for the information that you've shared with us today. It's so important for caregivers to take care of themselves when they're taking care of their family members. And again, it wasn't enough time, but I thank you again. And I hope this information has been helpful to someone.
Me too. Thank you so much.
Thank you.